Hi there. Hey, I'm Jen Rice, and I wanted to share today a little bit about sleep apnea. And you may or may not be familiar already with the definition of it, but essentially, sleep apnea is repeated upper airway obstruction during sleep. And I really wanted to talk about this a little bit more and kind of bring it out in the forefront because I think it is way more common than we think. And I also believe that there are a lot of younger people that suffer from this that don't even maybe necessarily realize it. In fact, last week when I was in clinic, I saw some younger people, I'm saying like in their 20s, in their 30s, that were maybe struggling with some conditions that, like diabetes, increasing blood pressure. I mean, being 35-ish years old and having to worry about type 2 diabetes, obesity, and, all these other kind of health problems that are coming up is sort of a young age for that to be happening. And when, when we look at patients, we want to say, are there certain symptoms that they're telling us about, and are we really asking about sleep? And I know in the past, I never really asked anyone about their sleep. It was sort of almost secondary as far as if we got to it, fine. If we didn't, we didn't. But now I'm being much more conscious about talking about sleep because I think it is so, how well we're sleeping at night has everything to do with how well we feel, right? So here are some symptoms that, people can have that may be suffering from sleep apnea. So, the first thing would be, of course, snoring, which they may or may not wake up themselves, right? And or certainly their partner could tell you. Gasping for air. So literally, waking up from sleep, gasping from air. And in fact, I have had a few patients tell me that they do, when I've asked about sleep, they said, actually, I have woken up gasping for air. And it happens almost nightly. And so then we're kind of steering towards, is the lack of oxygen going to the brain at night during sleep, is this contributing to hypertension, heart troubles, diabetes, daytime fatigue, all of that? So back to the symptoms, then you can ask about, or if you're feeling, are you feeling sleepy during the day? Do you feel like you could literally just take a nap in the middle of the day? A dry mouth, not just when you wake up in the morning, but a dry mouth that happens, really dry when you're waking up in the middle of the night. You feel like you need to go get a drink of water. That could be a sign of sleep apnea. And this one is really good. And I'm trying to listen more and more when I see patients to, can I hear them loud breathing, just sitting, kind of quietly in a room? Like if I hear the breathing, or if it's very shallow breath, they may or may not be at higher risk of sleep apnea. And so kind of paying attention to how loud one is breathing, at rest. Headaches can be a sign that you're not getting enough oxygen during sleep. Mood swings, irritability. They also mentioned bone loss and osteoporosis, which I thought that's pretty fascinating. And this is all from, so I've been reading in this journal. It's called the University Health Daily. It's basically made up of experts from all American universities, experts in their field, and they write daily reports on certain topics. And so the articles change over time, they get updated over time. This is kind of the latest information on sleep apnea and how it may be contributing to multiple health issues that people have. So I see you guys jumping on. Thanks for being here. I appreciate it. So I'm talking a lot about sleep today because I think that sleep apnea in particular is pretty easy to correct. The gold standard is a CPAP machine. The downfall to a CPAP machine is that it's a CPAP machine and you have to wear it when you're sleeping. And although they've come a ways, there are still patients will complain to me that it's uncomfortable. I personally haven't worn one yet. I probably need a sleep study myself. I think it's not a bad idea for people to have a sleep study if you have any of these symptoms, or if you're starting to pile on certain chronic illnesses, because we know that if we're not getting adequate oxygenation to the brain at night, and you're literally hopefully in bed 6 to 8 hours at night, that's a long time to have periods without oxygen going where it should be, and specifically going to the brain. So I wanted to mention 4 things though that the experts have kind of cited as, besides the CPAP, there are a few things you can do. Now, this doesn't go in place of doing a consult for a sleep study. It doesn't take the place of using a CPAP, but it's certainly something that you can begin. And number 1 is a healthy diet and exercise. And I know it's like, again, right? But for real, it is. So we know that if we eat better and we exercise at least 4 times a week, up to 30 minutes, that this actually does have an effect on the periods of sleep apnea. Just to personally kind of say, I have been someone that snores. I just have. You ask Dennis, he knows. It's much better though, since I changed my diet a little over a year ago and sort of eliminated certain foods, definitely the alcohol. I've started some other things, which I'll list out here as we get to number 2, 3, and 4. But it's just worth noting that when we change our diet and move a little bit more, that if the weight comes off some, that can have a nice effect too on some things like a sleep apnea, or predisposing us to having a worse sleep apnea. So the second one is antioxidant supplements, and that would be vitamin C, vitamin E, and NAC, which is N-acetylcysteine. And those supplements have been shown to be helpful for, sleep apnea or sleep problems. So for what it's worth, you can look into, I don't have specific dosing on here. And if you're interested in a little bit more about this, feel free to, private message me. I'm happy to dig a little bit deeper with you. Because I think there are things that we can be doing every day that are helpful. Third one is DHA, which is basically an omega-3 fish oil combination, and I'm not sure exactly why it's helpful for sleep issues or sleep apnea, but it's in the literature, so I'm sharing it here. And then the last one is vitamin D. Vitamin D, we hear so much about this, and it's not really related to, there are tons of people here in Southwest Florida who have a vitamin D deficiency, and we've got more sun to go around than almost any place else. It's more about absorption. It's more about how the body is using the vitamin D. So you may not want to assume that you're not vitamin D deficient, because it seems like a lot of people are. And I did a video on vitamin D a while back, and it had some values in it that you can look for in laboratory work, and you can certainly work with your primary care provider or naturopathic doctor to sort out the vitamin D, but that can actually help with sleep. So, I wanted to mention that they did this study about depression and sleep apnea, and this caught my attention. And then I'm going to jump off because I don't want this to get too long, but they did this study where they had people take this health questionnaire of their depressive symptoms, right? And then they kind of measured how they were feeling. And all of these people, about 228 of them, that participated in the study, they were having a high depression score. They were given a CPAP machine and began sleeping with their CPAP machine, and they had a 74% decrease in the responses that put them in that depressive category that originally got them into the study. So although it's one study and one sighting of that, it doesn't mean that across the board depression is completely linked to sleep apnea, or that correcting sleep apnea will correct depression. But I do think that having the best sleep we can have probably completely has to do with the balance and the connection that we have throughout our body. And so depending on who you talk with, they do believe that sleep apnea can be at the root of Alzheimer's, dementia. Certainly there's a connection with diabetes type 2, the hypertension. And so if you feel any of those symptoms I mentioned earlier, if you maybe you know someone in your family and you feel like this video might be helpful to them, if you want to share it with them or tag them in it, I think that getting more information out there and not being ashamed that we snore or ashamed that, you know, maybe we are a loud sleeper. There could be something physiological going on. It's correctable. There's other things we can do about it. We can bring it more to the forefront. Go see either a pulmonologist or a sleep study specialist. Do the study. They'll tell you, yes, you have it. No, you don't. So I think this can help to unlock some more information for you so that you can have the highest you know, quality of life that we can. And that's really, I think, what we all want, right? So I hope if you guys found this video helpful, feel free to share it. I'd love to hear your comments if you struggle with sleeping, if you've had a sleep study and it was a good experience, bad experience. Love to hear from you on that. I think that would help some other people that maybe watch this too. And I hope you guys have a great day, and we'll see you soon.